So your child needs a catheterizable channel. This is Betty Ann Thibodeau, Pediatric Urology Nurse Practitioner at the Stollery Children's Hospital. Your child's surgery will be done under a general anesthetic. Your child will be in hospital for about 5 to 7 days. Before your child is discharged from hospital, you and your child will be taught how to care for the catheters and the catheterizable channel at home. To learn more about what to expect on the day of surgery, go to the Stollery website and search Your Child's Surgery. Immediately after surgery, your child will receive pain medication through their IV and by mouth. Your child may have pain in the belly and along the incision. Over time, the pain will become less and your child will be switched to oral pain medications before going home. Once at home, the mild pain may continue for a little while. Over-the-counter pain medications will help to relieve the pain. Speak to your pharmacist if you have any questions about your child's pain medications. The bowels normally contract and relax in waves to move food through the bowels. After surgery, the bowels usually stop working for a period of time, and it can take a few days for the bowels to wake up and start moving again. Some medicines may slow the bowels down as well. Your child may not have much appetite, may be unable to pass gas, have some nausea and vomiting, and the belly may get distended or bloated. If your child has a lot of vomiting, your child may need a tube inserted through the nose into the stomach to drain the stomach until the bowels start working again. Usually when the bowels begin to work again, your child will have a lot of crampy pain in the belly. Getting up and walking around will help the bowels move and relieve discomfort. A catheterizable channel is a tunnel from the abdominal wall into the bladder. This tunnel allows your child to insert a catheter into the bladder through an opening in their abdominal wall. The Mitrofanoff procedure uses the appendix to make this channel, and the Monti procedure uses a piece of small bowel to make the tunnel. Your doctor will decide which channel is best for your child. Your child will have a large cut or incision in the abdomen below the belly button. Initially, the incision will be covered by steri-strips and a dressing, but the dressing will be removed before your child goes home. Your child will have a tube coming out of a small incision in the lower abdomen, which is called a suprapubic tube, and a tube out of their catheterizable channel to keep the channel open. These tubes will drain the urine from the bladder while the bladder and the catheterizable channel are healing. The urine will be collected in urinary drainage bags. These tubes will stay in place for at least 3 weeks. Daily care of these catheters will help prevent urinary tract infections, as well as prevent the tubes from getting plugged or pulled out by mistake. Your child may also have a tube with a bulb on the end called a Jackson-Pratt or JP drain. This tube will help drain extra fluid or blood from the surgical site. Sometimes a Foley catheter is inserted instead of the suprapubic catheter. A Foley catheter is a small, flexible plastic tube that helps drain the urine from the bladder. This catheter is put into the bladder through the urethra where the pee normally comes from, and then it's secured to the leg or belly with a securement device or medical grade tape. The urinary catheter in the Monti or Mitrofanoff catheterizable channel is a small flexible tube which is passed through the tunnel into the bladder. This catheter keeps the tunnel open while both the channel and the bladder heal. This tube also helps to drain the bladder and will be connected to a urinary drainage bag. This tube is inserted during surgery and will be stitched in place as well as taped to the abdomen with securement device or medical grade tape. This tube is usually removed 3 weeks after surgery. After the catheter is removed, you will be shown how to insert a catheter into the channel to drain the bladder. A suprapubic catheter is a small flexible plastic tube which helps the urine drain from the bladder into a urinary drainage bag. This tube is put in the bladder during surgery through a small cut in the lower abdomen. The tube is held in place by a couple of stitches as well as taped to the abdomen. This tube will stay in place until you and your child are comfortable with catheterizing the bladder through the catheterizable channel. As both the tube in the catheterizable channel and the suprapubic tube drain the bladder and are connected to urinary drainage bags, you may notice that one tube drains more than the other depending on how your child is positioned. Daily care of these tubes will help prevent urinary tract infections as well as prevent the tubes from getting plugged or accidentally pulled out. A Jackson-Pratt drain or JP drain is a special tube with a bulb on the end which drains any extra blood or fluid inside the belly from the surgical site. The bulb is squeezed to provide a mild suction which pulls the fluid into the bulb. The bulb is usually emptied a couple times per day. This tube is inserted during surgery and is usually removed before your child goes home. Both the catheter in the channel and the suprapubic catheter will be connected to large urinary drainage bags or bedside bags. These large urinary drainage bags can hold up to 2,500 ml of urine. These bags can be hung on the side of the bed or on a chair. These large urinary drainage bags should be used at night, anytime your child will be staying home, or when your child is sitting or lying for long periods of time. A leg bag or a small urinary drainage bag can be used for trips outside the house or during the day when your child is up and moving around. These bags are smaller and only hold about 570 ml. As a result, these drainage bags must be emptied more often. A leg bag can be strapped to the leg and hidden under your child's clothes. To prevent infections, it's important to always wash your hands with soap and water, before and after any catheter care, before and after any skin care, before and after irrigating the catheters, as well as before and after you change or empty the urinary drainage bags. Your child can shower or bath. You can hang the catheter bags outside the shower to keep them dry while your child showers or baths. You can wash around the incision with soap and water and then pat the area dry. Do not use any lotions or powders on the skin around the incision. Check the incision daily for any signs of infection. It is normal to have a small amount of redness around the suprapubic or the catheter in the catheterizable channel from the tubes rubbing against the skin. The incision and areas around the tubes can be left open to the air. Check the skin around the catheters every day. Clean the area around the catheters with soap and water. Clean approximately 10 centimeters down the catheter tubing, moving away from the skin or insertion site of the catheter. Rinse the area around the catheter insertion site and the catheter with clean warm water, then pat the area dry. Do not apply powders or lotions to the area. If there is a small amount of urine leaking around the suprapubic catheter or the catheter in the catheterizable channel, you can cover the insertion site with a gauze bandage. You can cut a slit or a Y in the gauze so that the gauze fits around the catheter better, then secure the gauze with medical grade tape. You can change this gauze daily or whenever it's wet. Do not unhook the catheters from the drainage bags unless you're changing the bags or irrigating the bladder. Always make sure the catheters are draining all the time and that tubes do not get twisted, kinked, or plugged with mucus. Irrigate the catheters if the catheters are not draining. Do not tug or pull on the catheters and always empty the drainage bags when they're half full. The drainage bags should always be positioned lower than the bladder so that they drain properly. Keep the drainage bags clean. Keep the suprapubic catheter and the tube in the catheterizable channel taped to the belly with a catheter securement device or medical grade tape to prevent the catheters from accidentally getting pulled out. Before starting the bladder irrigations, empty the urinary drainage bags, wash your hands, and gather your supplies. You will need warm water. If using well water, boil first and allow to cool before using. You may use bottled or distilled water as well. You will also need antiseptic swabs to clean the catheter connections, a container to collect the fluid you withdraw from the bladder, a 60 ml catheter tip syringe, and a clean towel or washcloth to place under the catheter connections to collect any drips or leakage when you disconnect the catheter from the drainage bag. Your child may lie in bed, sit, or stand when you irrigate the bladder. You may find that one of these positions seems to work better than one of the other positions when irrigating your child's bladder. To irrigate the catheter, fill a clean 60 ml syringe with water. Place a clean towel or washcloth under the connection sites between the catheter and the urinary drainage bag to collect any leaks or spills. Clean the connection site between the catheter and the urinary drainage bag with an antiseptic swab. Carefully disconnect the catheter from the drainage bag. Insert the water-filled syringe into the end of the catheter. Gently clamp the opposite catheter tubing while you're irrigating the catheter, or the fluid will run out the opposite catheter. Gently push the water through the catheter into the bladder. Without removing the syringe, gently pull back on the syringe to remove the fluid from the bladder. You should drain the fluid you instilled in the bladder, as well as any urine or mucus which was in the bladder. Continue withdrawing the fluid until you cannot pull back any more fluid. If you do not get all the fluid back you instilled, do not force it, as the catheter may be up against the wall of the bladder. Disconnect the syringe from the catheter and discard the fluid you removed from the bladder. Do not put this fluid back in the bladder. Repeat the irrigations until the fluid you drained from the bladder comes back clear and there is no more mucus being pulled into the syringe. Reconnect the catheter to the drainage bag when you're finished. Repeat the process with the other catheter. Always keep the drainage bag below the level of your child's bladder. As the catheter is drained by gravity, this allows the catheter to drain and prevents urine from flowing back into the bladder. Check often to ensure the catheter is draining and the urine is flowing into the drainage bag. Always empty the drainage bag when it's half full, as it will prevent the drainage bag from overflowing and the urine from backing up. To empty the urinary drainage bag, remove the drain spout from the sleeve at the bottom of the bag. Open the clamp on the drain spout and drain the urine from the bag into the toilet or a container. After draining the bag, close the clamp and reinsert the drain spout back into the sleeve at the bottom of the collection bag. Always wash your hands before and after emptying the drainage bag. When changing the urinary drainage bag, wash your hands and get your supplies ready. You will need a new urinary drainage bag, whether it's a large bag or a leg bag, a clean towel or washcloth to place under the connection site to collect any leaks, as well as to place under the new urinary drainage bag. You will also need antiseptic swabs. Empty the urinary drainage bag and wash your hands again. Place the towel or washcloth under the connection sites from the catheter, as well as under the new urinary drainage bag. Clean the connection site between the catheter and the old urinary drainage bag with an antiseptic wipe. Remove the old drainage bag. Before attaching the new bag to the catheter, remove the cap from the tubing and clean the tip of the tubing. Attach the new urinary drainage bag to the catheter and place the cap back on the tubing of the old bag. Always keep the caps in a safe place when you're not being used. Check the urinary drainage bags every day for any damage. You should change the drainage bags every 7 days or sooner if the drainage bag is leaking, damaged, or discolored. Discard the old or damaged urinary drainage bag. Some important points to remember about the catheters. Always wash your hands with soap and water before and after you do anything with the catheters or drainage bags, as well as when you perform any skin care. Always clean all connections with antiseptic wipes before disconnecting or reconnecting the urinary drainage bags. Make sure there are no kinks or twists in the tubing that would stop the flow of urine from the bladder. Irrigate the catheters if the catheters are not draining. If your child is very active, tape the connection between the catheter and drainage bag to prevent the tubes from coming apart. Sometimes your child may have some mild discomfort from the incision or tube sites. Use over-the-counter pain medications as directed. If you have questions about the pain medications, call your pharmacist. If the pain medication is not working and the pain is getting worse, call your doctor. Your child may have some minor skin irritation or redness around the tubes. This is perfectly normal. If the redness around the tubes is getting worse, hot to touch and spreading out from the tube, call your doctor. It's not uncommon to have some small urine leakage around the bladder catheters. Sometimes your child may also have some red, beefy looking tissue around the catheters. This can be treated in clinic if it becomes bothersome. These are pictures of minor skin irritation that you may see around the tubes, from the normal redness around the tube to granulation tissue. Granulation tissue is that red, beefy tissue that bulges out from around the tube. This can be dealt with in the clinic if it becomes bothersome. Call if your child has any signs of a urinary tract infection or infection around the incision or catheter sites. Signs of a wound infection may include irritated, swollen, red, or tender skin, pus from the incision or catheter sites, incision is opening up, increased pain around the sites, fever, or generally feeling unwell. Signs of a urinary tract infection may include foul-smelling, cloudy urine, blood in the urine, fever, lack of appetite, nausea, vomiting, or generally feeling unwell, as well as flank pain felt below the rib cage and above the waist on one or both sides of the back. Call your doctor, Betty Ann, or take your child into emergency if the catheters are not draining even after you irrigated them. One or more of the catheters has fallen out. There are signs of a urinary tract infection, wound infection, or infection around the catheter sites. Your child has increased pain in the abdomen or the incision. Your child has a fever or is generally feeling unwell, or you have difficulty managing your child's care at home. If you have concerns, you can call Betty Ann at 780-407-7010, or you can call your doctor. You will need some supplies to care for your child at home after surgery. You can either purchase the supplies from a healthcare store, pharmacy, or online. You may need to go to more than one store to purchase the supplies. For your convenience, you may purchase a care at home kit from the hospital. This kit will contain the supplies you require to care for your child for the first few weeks at home. This package must be purchased before your child is discharged from hospital. Please let your nurse know if you require a care-at-home kit. This is a list of supplies your child will need at home after surgery. The catheter in the catheterizable channel is usually removed 3 weeks after surgery. You will need to book a follow-up clinic appointment for the catheter removal. If you do not have an appointment booked when your child is discharged from hospital, call 780-407-1980 to book a follow-up appointment for approximately 3 weeks after your child's surgery. The catheter in the catheterizable channel is usually removed in clinic by your doctor 3 weeks after your child's surgery. During the appointment, you will be shown how to insert a catheter into the channel to drain your child's bladder. The suprapubic catheter will remain in place until you and your child are comfortable with the catheterizing through the channel. You will need to make another appointment in the future to remove the suprapubic catheter. If the stoma for the catheterizable channel becomes tight, you can insert a catheter into the opening and leave the catheter in place for 7 days to stretch the opening. Secure the catheter with medical grade tape or a catheter securement device. To prevent leakage from the catheter, either plug the catheter with catheter plug or tie a knot in the catheter. If you're using a knotted catheter, tie a knot in the middle of the catheter before inserting the catheter into the channel. Secure with medical grade tape or a catheter securement device. When you need to drain the bladder, remove the knotted catheter and insert a new catheter into the channel to drain the bladder. Once you're finished draining the bladder, remove the catheter and reinsert the knotted catheter again. This video is made to help you care for your child at home and made possible with funding from the Stollery Children's Hospital Foundation.